Hi all, I welcome you all to Confident Dental's podcast. Today we are here to discuss about the new product in the market, the PTB unit. It is our endeavor to discuss about one topic pertaining to dentistry through the vision of our speakers. Today we have with us Dr. Kishore to discuss on the science behind the PTB unit and about CBC. I welcome you, sir.
Thank you, Dr. Vinisha, for having me here.
Dr. Kishore, our audience would like to know what is the PTB unit about?
PTB is a revolutionary new device in the market, marketed by Confident. So this device has got air polishing at its core. Along with air polishing, this has got a specialized scalar unit, which has got titanium tips, which has got polyerythroketone, which are the peak tips, subgingival tip, a captive water unit, which is preheated. So all in all, in short, this is part of the CBC protocol of Confident, and this PTB unit gives you a professional, painless and precise experience for comprehensive plaque control regime.
You also explained about CBC. What is CBC about, sir?
Okay, CBC is an acronym for Confident Biofilm Control. So this Confident Biofilm Control is going to be a transformative change for the Indian dentists and the plaque control scenario. So Confident Biofilm Control aims to integrate comprehensively all aspects of biofilm control, be it the scalar tapes, the air polishers, or specialized fields like orthodontic biofilm control, implant biofilm control. And as part of air polishing device, we also have something called as a CBC protocol, which is a 12-step regime, which we are calling it as a CBC clock. So this in short is CBC.
Okay, sir. Thank you. Now, many companies in the market are explaining about air polishing. Now, how air polishing is different from our conventional scaling method?
Very good question, Dr. Vinisha. So let me first clarify. Air polishing here doesn't mean the polishing that the dentists employ post-scaling for polishing the teeth. No, this air polishing is different. Here, air polishing means specialized powders are used and there is a captive water unit. They are delivered at an optimum force and they form a slurry, and this is intended to remove the plaque biofilm, right? So specialized powders are used, and this is not to be confused with your conventional post-scaling polishing.
Doctor, you explained about air polishing. Air polishing effectively removes biofilm. Now, what is biofilm and what is the connection between the oral health and systemic health and how the biofilm impacts it?
Biofilm is essentially a sticky layer that continuously forms on your teeth and prosthesis. When I tell prosthesis, it can be anything ranging from your brackets, crowns or implants. So this sticky mat or sticky layer has got bacteria that are embedded into it, and they all collectively form a matrix. And once this matrix is formed, it is very difficult to dislodge this biofilm. So this bacteria which are teeming inside this matrix forms a nidus, and through the bloodstream they affect various systems of our body. See, everybody knows that plaque biofilm is responsible for your dental decay as well as periodontal disease, but that's not about it all. It can influence all your systemic conditions. There are more than 58 conditions which are implicated because of the ill effects of plaque biofilm. However, it is not a cause-effect relationship, but there is a direct and indirect pathways which can lead to multiple conditions, what we call the perio-systemic interrelationships. It can affect and cause you chronic obstructive pulmonary diseases, coronary heart diseases, preterm low birth weight babies. Even as recently as last month, there was a newspaper article which said, do you have brain fog? Blame it on your poor oral hygiene. So this is directly attributed to your biofilm, and it is known to even influence your Alzheimer's disease. Not only that, it can cause a whole lot of conditions like erectile dysfunction, osteoporosis, and nephrotic conditions, a whole lot. So your biofilm is directly or indirectly connected both with your oral health and systemic health.
Okay, doctor. Now, I also have a doubt that does the PTB air polishing also remove the calculus?
Very interesting question. See, what is calculus? It's a mineralized form of plaque. When plaque goes maturation, it mineralizes to form a hard substance or a flint-like substance called calculus. Now, the intention of this PTB unit and the air polisher is to comprehensively remove the biofilm, which it does a great job. It completely eliminates the biofilm and thereby greatly reduces the chances of developing calculus, because biofilm, the source itself, is removed. At the same time, it can even remove minor amount of calculus. However, to expect a air polishing to comprehensively remove long-standing bulky calculus is a slightly hard ask. So we have specialized scalar units along with the PTB machine, which will help in removing these bulky calculus.
Okay, doctor. Now you also told that the PTB unit comes with a scalar. How is it different from the normal scalar?
Yes, PTB unit is equipped with two hand pieces and it comes with about 14 ultrasonic tips, right? So this is different from your conventional scalar tips in the sense they are having most of the tips which are made up of titanium. Also, PTB unit comes with subgingival tips which are made up of thermoplastic material which can be directly inserted into pockets up to 4 millimeter, and they can carry out the operations there. And PTB is also equipped with specialized peak tips, polyether ketone. So these tips are again thermoplastic materials which can be directly used on the implants for implant maintenance, preventing peri-implantitis without gouging or damaging the implants, because these are softer and they are very effective and very gentle in managing the implant maintenance.
Okay, doctor. But I have a question. How is the titanium tips provided from PTB unit different from the stainless steel tips provided with conventional scalars?
Very interesting question. First, we should understand in physics, each material has got an inherent hardness to it. So this is classified as Knoop's hardness number, Mohs hardness number, HRC scale, etc. So if we take the HRC scale, the hardness of enamel is between 37 and 43. And if you take titanium, the HRC hardness is 30, which is much softer than that of enamel. On the other hand, if you consider stainless steel, the HRC hardness is above 50. It ranges up to 55 also. So when you use a harder material on a softer substance, it is bound to cause some damage. So that is why the titanium scalar tips are known to be incredibly gentle and effective on enamel without damaging it whatsoever. That is the beauty of titanium.
Okay, doctor. Now you explained a great deal about the PTB unit. Now, how can it benefit the dentist?
See, PTB offers a unsurpassed way of giving a gentle and precise and painless plaque control regime treatment for the patients. So through this, the patient's comfort is enhanced and thereby even the dentists are benefited in that way. And also, this PTB with the CBC protocol or the confident biofilm protocol, dentists can place this treatment as a premium segment treatment where even they can recall their different specialized patient groups like orthodontic patients, pediatric patients, implant maintenance patients, and have a special care regime for them and offer the services of PTB and the maintenance of these special care patients in a gentle and precise manner.
Okay, doctor. Now carrying forward, how will it benefit the patient?
We all know the first thing why the patient refrains from getting their teeth cleaned is because of sensitivity. This is their primary issue. But with PTB, this issue is taken care of. So PTB delivers the slurry and the air polishing is done in an incredibly gentle manner, so the patient will hardly experience any sensitivity. And even the remnant calculus, what might remain, is taken care by the titanium scalars, which are softer than enamel, so it is a pain-free experience. And since most of the biofilm is taken care by air polishing, Even over instrumentation by the scalers can be avoided by the dentist. So the amount of scaling done is also reduced for the patient. So this is like a therapeutic experience, and at the same time it is like a spa experience for the patients when they're undergoing PTB. That is how it can benefit.
Okay, doctor. During our discussion about the CBC protocol, you emphasized something about disclosing solution. What is this disclosing solution about and why it is to be used?
Let me tell you, as students, we were asked to use disclosing solution way back 25 years back when we were doing our undergraduate studies, and I still swear by that. Disclosing solution is the simplest, most cost-effective method of selectively staining the plaque biofilm. So even in our CBC protocol, we have implemented this. We use two-tone dyes that differentiates between the new plaque or the mature plaque. By doing this, this CBC protocol achieves what we call as a peak moment or a wow moment for the patient. Whenever we speak about the patients not brushing a particular area of their teeth properly, they always resist. They tell that, doctor, I'm doing as per your instructions. But when we visually show them the extent, the severity, the amount of old and new plaque, it is like a realization for the patient. And this reduces the resistance, whatever they might have about following the instruction of the dentists. So this is a peak moment for the patient. At the same time, we dentists get a fair indication of where the biofilm is concentrated, and as we target the air polishing, this staining disappears. So we also can avoid the over instrumentation with the scalers and limit our scaling only to the areas where the biofilm are still present. So that is the beauty of disclosing solution.
Okay, doctor. All our audience would like to know about the different powders that are used and what are the uses of the powders.
Now, powders form the crux or the heart of this air polishing because they do most of the cleaning along with the captive water pressure that comes out. Now, we cannot use any given powder and we have certain indications for each of the powder. So, let me briefly tell you what are the things. So, we first use a 14 micron powder called erythritol. This is basically used for subgingival and implant areas. Then we have a 25 micron glycine, which can be used both supragingivally and subgingivally. This will form the workhorse in your powders armamentarium. Then we have 54 micron calcium carbonate or sodium bicarbonate powders. So these are relatively bigger in size, the particle size, and they are effective in removing your stains. And these have to be used only in the supragingival area. However, in CBC protocol, we are using more of calcium carbonate simply because sodium bicarbonate, although is as effective as calcium carbonate, many patients cannot use that who are hypertensive, who are on a low sodium diet, and also sodium bicarbonate is a bit salty. So we try to avoid that. So we are going in with 14 micron erythritol, 25 micron glycine, and 54 micron calcium carbonate. And even the glycine that we are using here, it is mildly sweet, and it is glycemic index is 3. So it is low on glycemic index. So even a diabetic patient can undergo this treatment regime without any issues.
Okay, doctor. I have another question also. What is the difference between PTB, CBC and EMS GBT?
Okay. Now, different companies have different copyrights and different registered trademarks. The science behind your CBC and GBT are more or less the same. It is the air polishing, right? Even the powders that are used are more or less similar. It can be 14 micron erythritol, 25 micron glycine, or 54 micron calcium carbonate or sodium bicarbonate, or similar such powders. So basically the science is the same. However, each company have a different trademark, so they use their different protocols. However, PTB also comes with a scalar unit along with it, in the sense It is different slightly. Otherwise, it is more or less the same technology that goes behind it.
Thank you so much, Dr. Kishore, for giving us a great insight about the PTB unit and a detailed discussion about the CBC. Dear audience, thank you for your patient listening. We'll be back with a lot more interesting topics. Stay tuned and don't forget to subscribe.